Hello everyone, good afternoon. This is April and we're going to start talking about the brain. So the brain is one of my favorite topics because we all have one, hopefully, and we need help with it many times. The brain is an organ, and just like our heart, our liver, our kidney, it often needs proper nutrients for it to really work well. And one of the substances that is so prevalent in our everyday diet now is sugar and high fructose corn syrup, and it just sets the brain aflame, on fire. And so as a result of that inflamed brain, we become more prone to things like excessive worrying or obsessive compulsive type behavior, or even things like Alzheimer's and dementia are aggravated by all of this. So I'm going to break down the brain into 5 different areas. We're going to talk about the cingulate area today, and then we'll also talk about deep limbic and temporal lobe and prefrontal cortex and so forth. So today the fun topic is about the cingulate system, which I really like because it's the gear shifter of the brain, and it connects the 2 hemispheres of the brain, the right and the left hemisphere. So the right brain is usually thought of as the more creative, artistic side of the brain, while the left brain is more analytical and working with numbers and that type of thing. So we need both, do we not? We need both. So let's talk about how we can help ourselves with this issue with our cingulate system, which is the gear shifter of the brain. So the primary neurotransmitter associated with this part of the brain is serotonin. You've probably heard of serotonin if you've ever read about depression type medication, which includes things like SSRIs, which stands for selective serotonin reuptake inhibitor. And the function of that is just to keep serotonin in the synapse of the neuron longer so that you feel kind of more upbeat and more uplifted. Serotonin, actually one of the precursors to serotonin is something called 5-HTP. And you may have seen that if you shop for supplements or anything like that. But 5-HTP is a precursor. Tryptophan is a precursor. So foods rich in tryptophan are things like turkey, chicken, even red meat, eggs, peanut butter, milk, white potatoes. Those are all foods that are really rich in tryptophan. Hi, Dr. Tim. Nice to see you watching today. So we want to be also very careful about getting adequate protein intake. Protein intake is really vital because when we have spikes in blood sugar, it makes our brain spike as well. Our thought processes tend to spike, and we get more angst, we get more worrisome, all of those things. So you'll notice that if you're really eating well, if you're eating really clean one week, you'll notice that your ability to handle stress is far better than if you're not. And one time of year that I particularly like to point out is around Christmas season, because everybody loves to love us with sugar. And so when we get so much sugar, people are inevitably depressed by the time January rolls around. And I think it has a lot to do with shorter days and so forth, but it has a lot to do with how we're eating. So that's something that you can do for yourself. Get adequate protein intake, foods rich in tryptophan. Another thing you can do for yourself is get St. John's wort. Now, I caution you with this one because St. John's wort, while it's a wonderful herb, it really needs to be a high quality herb, and it also needs to be not taken if you are taking other medications. St. John's wort isn't a medication, but if you're taking medications, for example, like high blood pressure medication, that will cause a potentiating effect or an exaggerating effect on the blood pressure medication, and we don't want that because it'll drop too low. So it's best to avoid St. John's wort and use something else in the place of that. There's things like 5-HTP as an example. So the other thing that we can really do is sometimes there's ways that we can train our brain by doing certain brain exercises. So there's a book that I'm going to point out to you called Brain Lock, and it's probably available on Amazon. It's specifically for people with OCD type behavior, and maybe not all of us are considered obsessive compulsives, but maybe a lot of us have that type of tendency. And so we could probably get a benefit from this book. But what it does is it actually helps us to become aware of certain thoughts that are like obsessions, and we can start to retrain the way we think. And I won't go into how all that works, but it's actually pretty neat how it does work, and we actually can lay down new neuron pathways that help us to think differently and to cut short, to cut off at the pass the thoughts that get us into trouble or create more worry and so forth. I don't think I went over all the types of symptoms that happen when we have a problem with the cingulate area, but some of them include, besides obsessive compulsive thinking and worrying, oppositional type behavior. So if your wife says, "Hey, hon, do you want to go out to eat tonight?" and before the words are out of her mouth, you automatically say no, that might be oppositional behavior. There can be other, like addictive type behaviors. That's another thing. If you really struggle with road rage, that would be another one. Eating disorders, chronic pain, all of these fall in the cingulate area. So I hope you found this helpful. I'm excited to go over these other areas over the next month. And just remember, whether you're 1,000 miles away or right here in our own backyard, we are here to help you fall in love with the way you feel. 417-336-2620. Have a great day.